We'll just work our way down now as we move in the direction of the brachial plexus. The next major muscle of the back we talked about last time was the trapezius, and we talked about this odd description here. That'll come up again today, because if we work our way down from the trapezius to the splenius to the semispinalis, as we get deeper, you might imagine that those muscles will be attached to the spines of C1 to C6, and we will find that with the semispinalis. But remember, this one's attached to the ligamentum nuchae, which goes across the top of the spines of the first 6 cervical bones. And then innervation we talked about here with the accessory nerve, and you have an idea about where that accessory nerve is going. It comes off of the cervical portions of the cord, passes through the foramen magnum, joins the cranial root, comes out the jugular foramen. And so this particular nerve picks up stuff from the cord, takes it into the brain, and it comes back out of the brain again to go to the muscle. So the other thing is I've done this superficial and deep for you in numbers. So this is a 3 to 4 innervation with 11, and then we'll do the rhomboids 3 to 4, levator scapula. We'll work our way down the spinal cord. I'm working toward the brachial plexus. The next muscle group I want to look at underneath the trapezius is this one. You'll see it a couple times today. The levator scapula, which is attached, you can see here, to the medial superior border of the scapula. And then it runs up here attached to the transverse processes of the first 4 cervical bones. Now, if you guys don't want me to do this, then you can just suck it up. Because I'm a teacher, and so I do this. I'm not going to let this just ride. I'm going to stand up here and just blah, 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 right? So as we learn these muscles, when we see things like this, I'm going to point them out. These are also lab test questions. So if you learn this as you go, and you just keep reminding yourself of things that you've learned, then you'll remember it better. It's human learning strategies. So when I say transverse processes of C1 to C4, immediately something should have come to your mind. We've already seen some muscles there. In fact, all the transverse processes of the cervical bones have attachments for a muscle group that you've identified already in the lab that attaches to the first 2 ribs and is involved in respiration. The scalings, okay? So I'm not done with that. So I'm just going to keep going back to these things. When you see something, you go, wait a minute, I've seen something else there. I'm going to remind you of those things. So transverse processes of C1 to C4, as I said, superior middle medial border of the scapula, and 3 to 5. Trapezius was 3 to 4. This is 3 to 5. And so levator scapula deep to the trapezius. Now the other muscles that we'll talk about here momentarily, the splenius here as we go down. We'll tear the splenius off. You can see the splenius is going to have an attachment to this thick ligamentous band from C1 to C6. What is the name of that band? The ligamentum nuchae. Exactly. This is an attachment also. The trapezius sits right on top of it. It's why the trapezius is not on the spines of C1 to C6. Okay, so the levator scapula here. The next one is 4 to 5. Did you see how that happened? You see how it happened? 3, 4, 3, 5, 4, 5. 3, 4, 3, 5, 4, 5. You see how it's working down? Working down with the muscles. So trapezius, levator scapula, rhomboids. Now, the reason the rhomboids are here is because this is my introduction to the brachial plexus. Notice that we're lower now in the cervical plexus, 4 and 5. And we're going to start now at the rhomboids and the levator scapula. We're going to start to pick up stuff from these segments. So we're lower now with the levator scapula. 3 to 5, we're all the way down to 5. 4 to 5, we're all the way down to 5 on the cervical segments. And so at this point, the levator scapula and rhomboids are going to introduce brachial plexus for us. This is really the upper margin. It is not part of the plexus. You see here 4 and 5 cervical regions. You don't think brachial plexus, but it is on the margins here. The next step down is really going to get us into the brachial plexus. Okay, now where's the rhomboid attached? Medial border of the scapula, 2 pieces. In the cat, there's 3. Which one's missing here? Cat has a minor and a major. Minor, spinous process, C7, T1, major, T1, T5. Yeah? Pull the scapula out, see those muscles attached, medial border scapula, the spines. There's another one, another rhomboid in the cat. We don't have it. It goes all the way to the occipital bone. It is a phenomenon name that you will see over and over again. If it goes to the occipital bone, it will have the name capitis on it. So later when we see the semispinalis capitis, where's that going to go? Where's the splenius capitis going to go? The occipital bone. It's going to the head. Now the cat has a capitis here. We don't have one. But you have to find that one in the cat in the lab. Here's the minor and there's the major, the rhomboids. The levator scapula 3 to 5, transverse processes C1 to C4. Rhomboids C7, T1, T1, T5. Is there another muscle that we've seen from the spinous process of C1 to T5 already? A superficial muscle. Is there a superficial muscle that has been attached to the spinous processes of C7 to T5? Which one? The trapezius. Yes, it goes all the way to T12, right? But there's a shared attachment here in the spinous process for the rhomboids and the trapezius. So if you had the vertebra prominence and it had a little colored mark on the tip of the spinous process, what muscle attachment is that? Trapezius. The next little colored mark, slightly deep to that, is rhomboid minor. Yeah? Okay. So C7, T5, this is rhomboid attachments, C4, C5 innervation. Now, this shows you the nerve from C4 and C5. And of course for the levator scapula, it doesn't show it here because this is really emphasizing the brachial plexus, picks up a major nerve here that comes off and supplies both the rhomboids and levator scapula, called the dorsal scapular nerve. It is essentially at the very superior margin of what we think of as the brachial plexus. Notice that fibers here from 5 now and 6 are going to join forces, and fibers from 7 here are going to join forces, and then 8 and T1 are going to join forces, and we've got a massive nerve network now here that we're going to have to work through. So this is the upper margin, the dorsal scapular nerve. We're just working our way down the upper margin of the brachial plexus, not really considered part of it. But you guys know now, you're thinking about this dissection as superficial to deep. Trapezius, levator, and rhomboid. Trapezius, levator, and rhomboid. Okay, here it is. The brachial plexus is split up into the following terminology descriptions: roots, trunks, divisions, and chords. The roots extend from C5 to T1. All right, so what happens at T2? What major anatomy thing happens at T2 and extends all the way to T12?
Trapeze.
There's something big here, something significant that happens here. Okay. Yeah, but I'm thinking just general anatomy observations, where the nerves go. In the cervical regions, we network C1 to C3, anterior and posterior roots of the ansa cervicalis. C3 to C5, networks to the phrenic nerve. We're going to put all kinds of networks together here, multiple pieces here, multiple segments. We can come from basically get on Miss Frizzle's bus and ride on an axon from any of these segments out here to these muscles. So 1, 2, 3, 4, 5 potential segments all networked together. But what happens at T2? Right. Segmental pattern of innervation. The ventral rami, T2 to T12, do not plexus. Not until we get to L1, right? We're going to start the lumbar plexus there. Okay, so C5 and C6, C5 and T1, the roots. Now, this is a terminology problem. This is a terminology problem because we think in anatomy of a root as either a dorsal or a ventral root connected to the spinal cord, and that's not what they mean here. By root in the brachial plexus, what you mean is ventral ramus. So put a star by it. It's unfortunate, but that is the terminology. A root is a ventral ramus. So the ventral rami of C5 to C6 feed the upper, C7 feeds middle, C8, T1 feeds lower trunks. Let's have a look. C5 and C6 feed upper trunk, C7 feeds the middle trunk, and C8 and T1 feeds the lower trunk. Okay. Now, where are we here? We want to do a dissection and find this. Where, in fact, is this happening? You see where that is in the shoulder? Okay, now I am not going to make you track all the way back up to the trunks in the cat dissection. The major focus of the cat dissection is the big five nerves that come off of it: musculatus, median, ulnar, radial, and axillary. Those are the big five that we're going to emphasize in the laboratory. But if you found them, you should be able to track back up into the shoulder to locate these things. It's the same in the cat. Okay, so upper, middle, and lower trunks. And then the upper trunk feeds two divisions. So really tired, drink coffee. The divisions are anterior and posterior divisions. One forward, one back. So the anterior divisions of the upper and middle trunk feed the lateral cord. All right, so that's going to be the first nerve that we emphasize. The musculocutaneous and the median, the lateral cord. That one you should be able to find. So anterior divisions of upper and middle trunk. So lateral cord then feeds these two nerves and all of these muscles. The musculocutaneous basically is the brachial flexors, and the median is basically the antebrachial flexors. So the whole anterior side of the arm here gets innervation from the lateral cord. Okay, from what spinal cord divisions could you potentially? I'll say it this way because they're not all hard and fast this way, but just learn the brachial plexus and you'll always be able to figure it out. So what divisions of the spinal cord could you potentially get to the bicep or the flexor carpi radialis? What potential divisions could you get there from?
C5, C6, and C7.
3 divisions, yeah, exactly. So the anterior, roots I should have said. The anterior divisions of both the upper and medial trunk come together to form the lateral cord. Let's have a look. So trunks, upper and middle. Now, if you don't follow this, I'm trying to teach it to you. You can learn it in class. I know you're going to have to sit down with it to really memorize it. But if you look at it now, it'll make that a lot easier. You try to pick this up as we're going. Okay, so upper and middle trunks have anterior divisions that form a lateral cord. Upper and middle trunks have anterior divisions. They're not even labeled here, that form the lateral cord. So those two yellow connectors right there are, those are anterior divisions, right, of the upper and middle trunks. Okay, and then there is a medial cord, you can see here, lateral, the two yellow ones, a lateral and medial cord, and then there is a posterior cord. We'll talk about each of those in its turn. Okay, so lots and lots to do. Let's do one more here. What about, if I ask the question, so the axillary nerve feeds the deltoid muscle, big muscle on your shoulder that does abduction. All right. What potential divisions of the spinal cord could I use to get to the axillary nerve?
5, 7, 8, T1.
What did you say, Phil?
C5, C7. I
All-
was just looking at the air.
All of them, and why is that? Because the posterior divisions all go to the posterior cord. See that? the posterior divisions all go to the posterior cord. Okay, so it doesn't really work that way, but it's potential. You can potentially get information from all 5 of these divisions to the axillary nerve and the deltoid. All right, now the 5 major nerves here listed are musculaneous, median, ulnar, radial, axillary. And so you can see the lateral cord feeds these 2, the medial cord feeds these 2, and the posterior cord feeds these 2. Now notice here, there's a glitch in this. This makes good sense. Lateral cord to these 2 nerves, posterior cord to these 2 nerves. The glitch is in the middle. You see it? The medial cord feeds the median nerve, but so does the lateral cord. See that? So that's something you will find in your CAP as you work through this. So the lateral and medial cord come together to form the median nerve. This is a humongous nerve, the median nerve. Okay, so it gets axons from both the lateral and the medial cords. And then posterior is radial axillary, lateral, musculaneous, and median. Set up exactly the same way in the CAP. Okay, so where are these nerves? You're going to locate them as you're working through once you get done with the muscles, but you've already begun to see them, I'm hoping. From lateral to medial, it is musculocutaneous, median, and ulnar. So you can see these major nerve groups here. Musculocutaneous, median, and ulnar. Medial to lateral, across the cubital fossa. We'll talk a lot about this, y'all, but this makes good sense. The musculocutaneous is on the anterior part of the humerus. That's flexion. That's going to be the biceps and the brachialis. You can see the median nerve traverses right down the center of the forearm. So all the flexors except 2, which the ulnar picks up on the medial side. And then you can see the ulnar nerve passing here just behind the medial epicondyle humerus. That should be significant to you. You can see here it's going to feed a couple flexors here on this side, and then it's going to come down here and pick up all the sensory stuff from your pinky finger. So everybody's experienced this before, right? You hit your funny bone, what did you hit? You smashed the ulnar nerve into the medial epicondyle of the humerus. That's what you did. There's the ulnar nerve right there, right behind the medial epicondyle. And then the other big one here, the arm axillary is up here, doing teres minor and deltoid. And the radial, you can see here, is behind the humerus. The radial nerve is behind the humerus. If it's behind the humerus, it won't be any surprise to see that it is picking up information from the posterior cord. The posterior cord formed by posterior divisions, which come from upper, middle, and lower trunk. So you see how bad the brachial plexus gets after a while? You think it all the way through every time. Okay, radial nerve, tricep, muscles behind. And then look at this radial nerve. It comes here across on the lateral side. It comes anterior here, this radial nerve does, and then passes down the most lateral aspects of the forearm. So that will be significant for us as we pick up innervations in the forearm with the radial. All right, do that a lot. Back to the levator scapula. So just a reminder here as we're working our way down, can you help me with it? Trapezius, levator scapular rhomboid. Innervation for trapezius, 3-4. Levator scapula, 3-5. Rhomboid, 4-5. Okay, so now you also know that do this one more time. You also know that as we're working our way down to the brachial plexus here, we have picked up, up here, we've picked up the dorsal scapular nerve, which is going to innervate the rhomboids and the levator scapula. We're right on the edge. All right, now, as we continue deep into the back now, so there's levator, there's rhomboids. We're going to continue now deep to the trapezius and pick up the splenius and semispinalis muscles before we look at more on the shoulder. So the splenius capitis here is also deep to the trapezius. So, does it surprise you to see the splenius capitis attached to the occipital bone? No. Does it surprise you to see the splenius capitis attached to the ligamentum nuchae? No, that's what's under the trapezius, right? Okay, so this splenius capitis, it lists ligamentum nuchae as attachment. It also attaches to the spinous processes of C7 to T6. It also attaches to the spinous processes of C7 to T6. C7 is a major anatomical landmark. Yes? Called the vertebral prominence. The most dorsal portion, the most posterior dorsal piece of the spine of C7 has what muscle on it? I did this just a second ago with you. I'm going to keep pounding it. Help you remember. The most dorsal or posterior portion of C7 has what muscle on it? It's not attached to the spines of C1 to C6. It runs across the top of the ligamentum nuchae. It's the trapezius. The next one down would be rhomboid minor. The next one down, we're going forward actually, right? Dorsal to anterior, posterior anterior on the spine. Trapezius, rhomboid minor, then splenius. Yeah, so you guys have to find the splenius in the cat as well. It's also attached to the mastoid process and the transverse processes of C2 to C4. Okay, so I've seen two other things attached to the spinous processes of the cervical bones. One muscle group was involved in breathing and was attached to the first two ribs. What was the name of the muscle attached to the transverse process of cervical bones? The scalenes. Then I had a muscle that elevates the scapula attached to the medial superior border of the scapula. The levator scapula. And now I've got the splenius attached to those transverse processes. Okay? So this gets cervical innervation, dorsal rami. Whoa! That changed. I picked up the dorsal scapular nerve to the rhomboids and levator scapula. I'm right on the edge of the brachial plexus, and I have been introduced to it. But as I work my way down from the trapezius to the levators and rhomboids to the splenius, what just happened? What does that mean, dorsal rami? Okay, is that going to be on this picture? No, because all of these roots are ventral rami. So the ventral rami form plexuses and go to the major nerves and pick up most of the muscles. What muscle groups are going to pick up? So you told me dorsal rami are segmental, right? Just like the ventral rami, the thoracic regions, they go to the segment, they come off, and they go right to the piece of muscle they're corresponding to. So what muscle groups are the dorsal rami going to pick up then? We're going to see this as we work our way down. From the splenius to the semispinalis down to the erector spinalis. These are the deep muscles of the back. I said this before. This is the take-home message. The dorsal rami of the spinal nerves go to the deep back muscles. So that's where we are now. The splenius is a deep back muscle. Oh, that's not the one there. There it is. I was saying it's the dorsal rami. It's a big deal there. All right. Now, the next one down is the semispinalis capitis. And look, there it is again. The dorsal rami. So this one has three names. I like to point these out. It's a good time to point it out for names. Capitis, cervicus, and thoracus is superior and inferior. Capitis to the occipital bone, cervicus to the cervical bones, and thoracus to the thoracic bones. Now, this is where the complication of all the erector spinae begin. So I'm not going, at this point, when I get to the semispinalis, I always say, look, the numbers are going to get crazy. And really asking students to distinguish between, like, did it attach to C1 versus C5, and after a while, that really becomes unfair. there will be a smattering of that, but it will not cost you an entire grade if you cannot remember all the individual numbers, right? Because I want you to take something away from anatomy with you, and if you get yourself bogged down in the T7, so the ones I'm pointing out are the ones that are important to me, right? C7, better know that one. That's the vertebral prominence, and you can dissect and think about what's going down superficial to deep there. Okay, but at this point, the numbers are going to begin to get somewhat ludicrous in terms of remembering all the values. So I have them listed here for you, but I just want to do one of them. Okay, so notice that there's attachments here to the transverse processes of C7 and T12, to the spinous processes of the cervical bones, and to the spinous processes of T1 to T4. Okay, so if you were teaching here, you see some things that I've been emphasizing that I might want to point out here? Have we talked about the spinous processes of the cervical bones a lot? Okay, so this is going to be an important feature. So if I'm on the spinous processes of the cervical bones, is the trapezius attached there? No. Okay. What is on top of the spinous processes of the first six? The ligament of Nuche. And what muscle is really fused into the ligament of Nuche? The trapezius on top, and then fused into it just under that. Huh? No. Does this help? The splenius, right? And so now if I've dissected off the ligament, now, the splenius, I'm deep now to the splenius. The next deep muscle group are the semispinalis muscles. And you see what's missing here? The ligament of Nuche is gone. And now, the muscle group is attached to the spinous process of the cervical bones. Okay, so I think that's a fair thing to ask. It really is a big picture anatomy thing, as I'm dissecting superficial to deep. Trapezius, levator, scapula's off. Splenius is off. Next one down, semispinalis. And you'll also remember, as you do this, that once I get to the splenius, I have lost the ventral rami. I am now being innervated by the dorsal rami of these spinal nerves to the deep muscles of the back. Okay. Now, this is the erector spinae. This is where it gets completely nuts. And so I have all the descriptions here for you, but here's what I want you to do. I want you to remember the names, the general feature names. Okay, so I've done some of this with you already. For example, I've already talked to you about the names capitis, cervicus, thoracus. There's one more. It is called the lumborum. So I'm just looking for the name here, right there, L-U-M-B, the lumborum muscle. Okay, so here's what I want to say. If it is a deep muscle of the back, these postural muscles that help with posture and really sophisticated movements in the back, then they will have names like this. Part of their name will be capitis, cervicus, thoracus, lumborum. That part of the name will tell you where it's attached along the spinal cord or the skull, from superior to inferior. So let's just put names together here, right? So if it's got a cervicus name, then I know it's attached to the. If it's a capitis name, it goes to the skull. Yeah. Okay. And so I can do this with lumborum. So you know if the name is capitis, cervicus, thoracus, lumborum, where the muscle is. Okay. Here's the way. So that's top to bottom. To go from medial to lateral, we call them spinalis, longismus, and iliocostalis. So superior to inferior is capitis, cervicus, thoracus, lumborum. Medial to lateral is spinalis, longismus, iliocostalis. So where is the longismus capitis attached? Okay, so it's not right on the cord. Yeah, it's intermediate. It's an intermediate muscle. And where does it go? To the skull. Good. So longissimus capsule. All right, what about the next one? The iliocostalis cervicus. That's a very lateral muscle, and where does it go? To the cervical bones. Okay, so this is not a hard and fast rule, but different books will have different numbers for these. There's at least 9 and possibly 12 of these that can be named. And they're named like this. And so I don't care to go through each one of them. I don't see what the point of that is. You won't remember it anyway. But you'll be doing great if you can remember capitis, cervicus, thoracus, lumborum, and spinalis, longissimus, and iliocostalis. If you find a muscle, you probably could make up its name by looking at where it attaches, using this terminology. Okay, so the erector spinae muscles, the deep muscles of the back. I wonder what kind of innervation the erector spinae receives. Dorsal rami. Yeah. So splenius, semispinalis, and the erector spinae all get dorsal rami innervation. Okay, now back to the shoulder. So I've gone deep on the back, and now I'm going to work my way back to the brachial plexus here. You can see that the deltoid muscle here on the shoulder. So look, in the dissection, I did the face and the neck. I turn around and I got the back. Now I'm coming back around. So the shoulder here, you guys know that this muscle, the deltoid, has 3 different names in the cat, right? Clavodeltoid, acromiodeltoid, and spinodeltoid. All right, so attachments here for the deltoid shared, really, on the clavicle and the spine. On the clavicle and the spine, and acromion for the trapezius. And then it attaches to the deltoid tuberosity of the humerus. It gets axillary nerve innervation. Now, let's dissect down through the shoulder. I have this in here every 3rd or 4th slide, just to return to it over and over and over again. Brachial plexus. The reason I pointed it in here is because, look, the axillary goes to the deltoid. If I rode backwards on the axillary nerve, I would go to the posterior cord, right? From that posterior cord, I could go to any of the posterior divisions, right? From any of the posterior divisions, I could go to any of the trunks. And from upper, middle, and lower trunk, I could go C5 down to T1. The axillary is a great place to start thinking about brachial plexus. All right, now, if I tear the deltoid off, you can see the shoulder joint here, that under the deltoid, there are some telltale signs of a synovial joint. Now, I'm going to define this for you momentarily. The telltale signs of a synovial joint. This is one of the most mobile joints because the head of the humerus appears to be too large for the glenoid cavity that it sits in. And so the deltoid actually abducts the arm here, which I'll teach you this joint term in just 1 second. But this joint is actually very mobile. In fact, it's useful for defining all kinds of joint motions. And so with the head of the humerus, I can flex, extend, I can abduct, I can adduct, I can circumduct, I can rotate. So there are all